Good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. Today, our speakers are joining the briefing virtually to adhere to social distancing guidelines. We will begin our briefing today with opening remarks from Dr. Thomas Farley. Dr. Farley, you now have the floor.
Good afternoon. The news today with the epidemic is mixed. Case counts continue to rise nationally and in Pennsylvania as a whole. Here in Philadelphia, our daily case counts over the past week have been stable. So here are the numbers. Since this time yesterday, we've identified 157 new cases of the coronavirus in Philadelphia residents, bringing us a total of 28,024 since the beginning of the epidemic. Now, those cases were distributed over the past few days. If you look at the last week, ending last Saturday, we're averaging about 110 cases per day. And we're averaging about 5 to 6% of those who were tested testing positive. Now, I will point out that we are having delays in reporting a positive test result to the health department. I'm getting concerned that delays in the reporting may make it harder for us to be able to track our data trends. They maybe influence our data trends. And so in the future, I'll let you know if I feel like those trends may be giving us a false sense of numbers decreasing, when in fact it may just be reporting delay. Of those cases that are reported to us, we're still seeing a predominance of younger people. For today's new cases that we're reporting, 32% were under the age of 30 and 58% were under the age of 40. For comparison, for the epidemic as a whole, 21% are under the age of 30 and 39% under the age of 40. So substantial shift towards people in the young adult years. Since this time yesterday, we've identified 18 new deaths from the coronavirus, bringing us to a total of 1,664 since the beginning of the epidemic. Now, that larger number today was a result of a match with death certificates, which we do about once a week, and identified deaths that have occurred in the past, generally over the past 2 weeks. We're running between 1 to 2 deaths per day in the past 2 weeks, which is far lower than we were before, but that's now fairly stable. Of those total deaths, 863 or 51% are nursing home residents, and that is pretty stable where we were before. A little bit more on testing. A couple days ago, I gave you a breakdown of the race of people who've been tested across the city. There's more data on the demographics of those tested, both positive and negative, that's now on our website, and that'll be updated on a regular basis. As I mentioned earlier, we're still seeing long delays, 7 days or more, for the reporting out of positive results from 2 large out-of-state laboratories. That's LabCorp and Quest, 7 days or more. And these 2 labs do about 1/4 of the tests that are done on Philadelphia residents. And the reason is that those labs have become overloaded with a very large demand from other parts of the country where they're seeing surges in the epidemic. So we're working to see if we can redirect those tests that are collected in Philadelphia to other laboratories that don't have such a bottleneck. But I want to reiterate the message I made a couple days ago to those people who are tested in Philadelphia. You should stay isolated until you get your test results. And it may be 7 days or more until you get your test results. I understand that's very inconvenient, but it's simply that's where we are right now. And until you get your test result, you don't know whether you're going to be positive or negative. More information about the different sites where you can get tested, again, is www.phila.gov/testing. Now on social distancing, yesterday we held a press conference where the Philadelphia School District announced their reopening plan. That reopening plan included reducing the number of children in school in any given day by having children go to school only 2 days a week. Some would go Monday, Wednesday, the others would go Tuesday, Thursday. That would reduce by half the number of children who were in the school at any given day. And that greatly reduces the crowds and provides more opportunities for social distancing. There are many other safety steps that are built into the plan. As I said yesterday, there's no way that we can reduce the risk of this infection in schools to zero, but we do think that this plan minimizes that risk. Now that is the plan for the Philadelphia public schools. We know that there are other schools in Philadelphia, and there's guidance for all schools to follow on the website. There's one guidance for elementary schools, and there's another guidance for middle and high schools. And that's for schools, but there's also colleges and universities that are not too far off, maybe opening up for the fall semester. But the ages of people who go to colleges and universities, there are particular reasons to be concerned there. These are the ages where we're seeing the greatest increase in the epidemic right now. So we've asked those colleges and universities to give us their reopening plans, and we're reviewing those plans right now to see how we can minimize the risk at those institutions. Yesterday, the governor announced additional social distancing mitigation steps for the state as a whole. Most important, from my perspective, he's closing bars, and he's restricting restaurants that have indoor dining to less than 25% of their total capacity. He's also restricting indoor events to fewer than 25 people. With these changes, this brings the rest of Pennsylvania much closer to the policies that we've had over the past few weeks already in Philadelphia. So I strongly support those actions. I think that's the right thing for the governor to do. The one area where it's different is here in Philadelphia. We are not allowing indoor dining at all. Across the rest of the state, indoor dining is allowed, but with a much restricted capacity. And I think that consistency overall is good. It makes it easier for people to comply when there's the same rules at the city level and at the state level. And the governor did allow gyms and fitness centers to stay open under some strict safety standards. It required masks use at all times, 6-foot distance between people participating in the gyms. And he recommended that people exercise outdoors as much as possible rather than indoors in the gyms. So after consideration here in Philadelphia, we will be allowing gyms and fitness centers to reopen effective Monday with similar safety requirements, very strict safety requirements. Masks will be required at all times. 6-foot distance will be required at all times. Exercise classes will have to be fewer than 10 people in addition to the distancing requirement. And there are other guidance, other standards will be on guidance that we're going to be posting on our website. And likewise, we're encouraging people to exercise outdoors whenever they can. Now, let me just note that many people find it difficult to do vigorous exercise while wearing a mask. And if so, then we recommend that you avoid gyms because the masks will be required in the gyms. Maybe that the gyms will be used primarily for weightlifting, not for aerobic exercise. Now, we want to be certain that gyms are following these safety standards so we don't have risk at these facilities. So the Department of Public Health, hold on 1 second. The Department of Public Health has not required permits of or inspected gyms in the past. But we are going to be enforcing strictly. So we will be doing inspections at this point. We'll be doing inspections proactively, unannounced, as well as in response to complaints. So unannounced and unscheduled. We will just have our inspectors show up at gyms, and they're going to see whether people are wearing masks, and if people are keeping the appropriate distance, and if they're in compliance with their other standards. So I'm going to be putting gyms on notice, both here today with this information and in a letter that we'll be sending to gyms about this, and making it clear that if people are not wearing masks when our inspectors go in there, we will be closing those facilities. And if we have cases of the coronavirus infection that are linked to gyms, we will close facilities. And if the epidemic surges, we may require the entire sector for gyms to close as part of a larger shutdown. That possibility still exists, especially with the epidemic trending in the wrong direction right now. So any gyms that are opening with this opportunity have to be aware that they may open and then in a few weeks have to turn around and shut again. But we want to give people the opportunity to have that exercise, which is good for health, if they follow these very strict safety standards. Then let me remind everyone of the safety precautions. Masks are so important right now. We need to have an increasing percentage of people in Philadelphia using masks. So we do have our mask media campaign, which is out there. You've seen it on buses elsewhere around the city. Much is up so far. There's more to come. We're also distributing flyers and posters to more businesses across the city. We'll continue to do that. So the businesses will be giving you a reminder that you need to wear a mask. And it's also a reminder to the businesses that that's part of their responsibility to require anyone in retail stores to be wearing masks. Distancing is important, likewise, as part of the recommendations, and reducing crowds. Just remind people as well that anybody who can continue to work from home should do so. So have fewer people in general going around and fewer people at the work site. And we're recommending that people avoid social events. We do know that social events are taking place, but we especially think that these social events are contributing to the spread among young adults, and that's what's driving the epidemic right now. So that's where we are today. More information on all of the epidemic, visit our website, www.phila.gov/COVID.
Thank you, Dr. Farley. We are now going to turn it over to Armando for the Spanish language translation of Dr. Farley's remarks.
Actualización en materia de salud para el jueves 16 de julio del 2020. Los casos continúan aumentando a nivel nacional y también en Pensilvania. El reporte de casos en Filadelfia se encuentra estable desde la semana pasada. Se han reportado 157 nuevos casos con un total de 28.024 casos acumulados. En promedio, hemos tenido 110 casos diarios durante la última semana. Aproximadamente el 5 al 6% del total de pruebas realizadas han dado resultados positivos. El mayor número de casos se ha registrado entre los jóvenes. El 32% de los casos reportados el día de hoy se han dado entre los menores de 30 años y el 58% de los casos entre los menores de 40 años. Hoy, lamentablemente, reportamos 18 nuevos fallecimientos por la COVID-19 en la ciudad. El total acumulado de muertes por la COVID-19 es de 1.664. Reportamos también este número elevado de muertes como resultado del cruce entre las bases de datos. En las últimas 2 semanas, el promedio de muertes fue de 1 a 2 muertes diarias. 836 de estas muertes se registraron en hogares de ancianos y representan un 51% del total de muertes. En relación a la disponibilidad de pruebas, en el sitio web encontrará mucha información de utilidad respecto a las pruebas. Seguimos viendo también largos retrasos, de un promedio de 7 días en el reporte de casos positivos, en el caso de los laboratorios grandes como LabCorp y Quest. Estos laboratorios realizan un cuarto del total de pruebas en nuestro estado. La razón de este retraso es la gran demanda, no solamente del estado de Pensilvania, sino de los otros estados. Un mensaje para todos los que se hacen las pruebas es, por favor, mantenerse aislados en la medida de lo posible hasta obtener los resultados, y esto puede tomar hasta 7 días. Retomando el tema de la evolución de la pandemia en los Estados Unidos, vemos que los casos se están incrementando rápidamente. Asimismo, hemos visto un repunte de casos en el oeste del estado. El mantener la distancia social es clave en esta fase. Con respecto al plan de vuelta a clases, se anunció el día de ayer que se reducirán el número de niños en las aulas. Se tomarán todas las medidas de seguridad necesarias, el uso de mascarillas, el distanciamiento social y el monitoreo de síntomas, entre otros. Las directrices para las escuelas de Filadelfia se encuentran en nuestro sitio web. En cuanto a las universidades y los colegios universitarios, dadas las edades de los universitarios, tenemos serias preocupaciones y estamos revisando los planes para su reapertura. El gobernador Wolf anunció ayer un plan de mitigación que ordena el cierre de los bares y el servicio de comidas en el interior de los restaurantes, que queda limitado ahora al 25% de su capacidad. Los eventos bajo techo quedan limitados a menos de 25 personas. Estas medidas que ordena el Estado se asemejan a las medidas que dictamos nosotros aquí en Filadelfia y cuentan con nuestro respaldo. El observar las normas de forma constante es importante para lograr su cumplimiento total. Anunciamos que los gimnasios podrán reabrir nuevamente bajo estricto cumplimiento de ciertas medidas. Recomendamos los ejercicios al aire libre sin olvidar que el uso de las mascarillas es obligatorio, así como el mantener la distancia social en todo momento. Les recordamos a todos los residentes de Filadelfia que debemos mostrar un alto nivel de cumplimiento de las precauciones de seguridad. El uso de las mascarillas o tapabocas al salir de casa. El mantener la distancia social en todo momento. Con respecto al control de las multitudes, la recomendación es para que todas las personas que puedan trabajar desde casa continúen haciéndolo. Y otra recomendación importante es que las personas eviten los eventos sociales, y esto va especialmente para los adultos jóvenes. Quiere a tus vecinos, quiere a tu ciudad de Filadelfia, así que usa tu máscara. Gracias.
Thank you so much, Armando. We are now going to move to our Q&A portion for members of the media. So I'd like to ask all of those who are joining us for Q&A to please unmute and turn your video on at this time. We will start with questions related to COVID-19. And obviously, if time permits, we will open the floor to other topics later. So if your hand is raised right now for another topic, please lower it and we will definitely get to that later. And in addition to Dr. Farley, we have Mayor Jim Kenney, Managing Director Brian Abernathy, and PHA President Kelvin Jeremiah joining us today for Q&A. And if you are asking a question, please just address who it is addressed to so that we can help route those questions quickly. For those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you limit your question to 3 or fewer during these briefings so that we can get to all press outlets that are here with us today. We will begin questions with Mitch Blocker of NBC 10. Mitch?
Hey, good afternoon. Dr. Farley, with a 7-day lag, do you have enough up-to-date information to accurately gauge the infection right now?
Well, I am concerned about that. Now, that 7-day lag is not for all of our tests. It's for 1/4 of the tests. So we do have some picture of what's going on, but it is possible that our view of what's happened in the past few days is somewhat thrown off by just that delay.
What is the impact of that? What does that mean for your ability to react to this pandemic as the public health official and leader of the city?
Well, we have multiple sources of information. Certainly, this is a key one. We would prefer to have it be better than it was, but it does make it potentially makes it that we're a few days delayed in knowing what's happening, make it slower for us to have the response. We're going to be looking at our other sources of information as well to try to minimize the risk of that. I'm more concerned, frankly, though, on the impact on individual people who are going to get a test and won't get the result for 7 days. And then, of course, contact tracing isn't of much value if the positive result doesn't come out for 7 days. So again, this is a national problem, not just a Philadelphia problem. We're going to do what we can about it, but at least want to let people know that this exists and that they have to address it in the short term.
You said on Tuesday that fewer than 200,000 total Philadelphians had been tested at all since the start of the pandemic. I'm curious that's less than 15% of the city's overall population. Is your scale of testing even approaching a large enough sample size for you to have an idea of where we're at? And now you toss delays on that. I'm just wondering if you have the kind of information and the scale of information that you're going to need in order to put out fires when they pop up.
Yeah, so I said before that we do want to increase our testing. My goal is ultimately be at 5,000 tests per day. There's a number of reasons why we're not there yet, but I think it's not appropriate to take that number divided by the whole population because people's status can change all the time. And so even if we tested all 1.5 million people today, that wouldn't tell us what's going to happen tomorrow. So it's more, we want to know that if people have symptoms, that they can be identified right away, and that we are testing enough people to get a sense for where the epidemic is going overall. We do think that most people can get access to testing now. We have 55 test sites across the city. We have a pretty good sense of where the epidemic is because we can also look at the percent positive in addition to the number positive. So we're in a much better position now than we were in March when we started out and we were doing virtually no testing. We want to do more, but it's not as big a problem as you would suggest.
Thank you, Doctor. I do have some questions about the camp as well. Is that for later, Kelly?
Yeah, Mitch, we'll come back to that, but thank you. We're going to go to Shaira Arias now of NBC 10 Telemundo.
Okay. Hi, Kelly. Thank you. Armando.
Buenas tardes, Shaira.
Buenas tardes. La pregunta es relacionada con el COVID y con el campamento, las dos cosas. En medio de que el gobernador está preocupado por el alza en casos, ¿qué tan preocupados están aquí las autoridades, el oficial, el doctor Farley, por lo que viene siendo lo que representa en cuanto a la sanidad este campamento que va a continuar y no se sabe hasta cuándo, por ahora? ¿Qué tan preocupados están ellos?
Están preocupados están ellos. The questions have to do with COVID and also with the encampment. And the question has to deal, given that the governor is concerned about an increase in cases, how worried is the city about letting the encampment remain, given that it represents a danger for public health?
So Armando, I'm having a little trouble hearing your audio, but I think that the question was, am I worried about COVID at the encampment? I'm certainly worried about COVID in any crowd of people outdoors or indoors. Outdoors is probably less a risk than indoors, but it's still a risk. And so, yes, we would definitely not want to have the encampment there. And I know that other city leaders have been working hard to try to resolve that situation.
La pregunta tiene que ver con la preocupación que podamos tener con respecto al campamento y ciertamente nos preocupa todo lo que tenga que ver con el COVID y con el campo y con todas las multitudes que puedan agregarse en espacios abiertos y en espacios cerrados. Nos preocupa más, obviamente, los espacios cerrados y se están tomando medidas a nivel de la ciudad para resolver este tema del campamento.
Kelly, I would like to follow back with other questions about the encampment. So I guess we can leave that for the second round as well.
Yes, thank you. Noted. We're going to move now to Al Lubrano of the Inquirer.
Hi, this is about the encampment. Do you want this now or do you want to wait?
We're going to go finish up our COVID questions, but we'll come back to you, Al. Thank you. Natasha Brown of CBS 3.
Hi, this question is for Dr. Farley. We just wanted to get your reaction, Dr. Farley, to the policy lab at CHOP forecasting a COVID-19 resurgence in the Philadelphia area. Have you heard of that?
Yeah, I'm aware of the models that the policy lab has done. And I'd say what they've done is just put a little more mathematics behind the same concern that we've had for some time now. That we're seeing increases in cases around the country. We're seeing increases in cases around the rest of Pennsylvania. And so that definitely puts us at a greater risk for an increase in cases here. That's why we did not allow restaurants to open up with indoor dining, for example, a few weeks ago. And so that they have a model that is similar to that. All models are just an attempt to try to predict the future. You can't totally predict the future, but it says that there's reason to be concerned, and we are concerned.
Yeah, and just in reference to the gyms and fitness centers being open on Monday, what's your biggest concern? I know you said you're going to do kind of pop-up inspections in a sense, but what would it take when you say that you may ultimately have to shut some of these centers down if they're not following policy? I mean, if you see spikes in coronavirus cases, or what are you looking for?
Yeah, our biggest concern around the gyms is that when people are doing vigorous aerobic exercise, it's very uncomfortable to wear a mask. And so the gym users are not going to want to wear masks, and the gym owners may not want to enforce that. We think if they do enforce that, that they can operate in a safe way. But we're really putting the onus on the gym managers to do that enforcement, and then we're going to inspect and make sure that that takes place. If we inspect and we find out that they're not wearing masks, then we're going to say this opportunity is failing, and so that gym cannot be open. Or if we see cases occurring where someone got infected, and from our contact tracing, we believe they got infected in the gym, likewise, we would shut that down. So it's an attempt to meet the interest in exercise, which is good for health, while also being very careful about infection control in the process. And so I want to also reiterate what I said before. For those many people who find it difficult to do vigorous exercise without a mask, don't go to gym then, because you're not going to be allowed to run on the treadmill and not wear your mask.
Okay, thank you very much.
Great, thanks, Natasha. We're going to go to Corey Clark now of PCN.
Hi, this is in reference to athletics, interscholastic. The PIAA is going to move forward with fall sports. And I guess they're looking for guidance from the governor or maybe you guys. Is there any chance that the city will step in and provide any kind of guidance for interscholastic athletics?
So we have guidance right now on our website about outdoor sports and exercise that includes some pretty strict limits on how that exercise is done and a prohibition on spectators. And so that guidance is in effect right now. The epidemic could change, that guidance could change in the future. But in the city of Philadelphia, they need to follow that guidance.
But so right now, there's no reason for the city to step in and prohibit that.
Well, that guidance has prohibitions in its own right. And so I'm not quite sure what.
I'm just saying football and fall sports can proceed in the city as far as you're concerned.
No, not necessarily. Read that guidance carefully because there's some real limits on what they can do. And again, I'm not sure what they're planning on doing, but having.
Can they play games?
I have to refresh my memory on it, and I think we're certainly discouraged playing competitive games between two teams. I don't know if it actually prohibits that. It certainly prohibits spectators, and it limits the number of people who are involved. So I'm going to have to refresh my memory myself, but you can do it as well. So there are some pretty strict limits on it. I believe that what the PIAA may feel is okay is not in keeping with that guidance.
So would you then be the one who could enforce that, or would that have to come from the governor?
No, the city of Philadelphia can be more restrictive than the state as a whole. And so they have to follow the order in the city of Philadelphia. for, if they're playing in Philadelphia.
Right. Thank you.
Thanks, Corey. We are going to go now to Martin Pratt of Philly YBN.
These two questions are for Dr. Farley. First, Dr. Farley, can you guys hear me?
Yes.
Yep.
Okay. So can we expect the same adherence you have with the gyms to places of worship, to any place that has an outbreak? And there was a report given that masks were not on.
It's tougher in places of worship. There's a real First Amendment right there, and I think that it's going to be tougher for us to shut down a place of worship. We certainly want everyone to follow our standards wherever that takes place. We certainly will be, if we find evidence of spread in one of those facilities, we'll be talking to the facility manager about safety guidelines, but we are not, may not be regulating in the same way that we're regulating gyms.
Would the same thing be applicable to schools?
To
schools? Would the same thing be applicable to schools?
Well,
where there's an outbreak, where a teacher gets it, 3 or 4 students get it, and...
Yeah, we are looking now, what would our criteria be for shutting an individual classroom or a school or the entire school system? Any of those may take place if we're finding evidence of spread. It really depends on how much spread we're talking about.
Okay, and last question is, I know New York has instituted, if you come to New York and you're from Florida, you need to fill out some paperwork. Will Philadelphia be instituting something similar?
Yeah, I don't think there's any practical way for us to put requirements on people traveling in and out of the city. There's just so many ways to travel in and out. We don't have, borders and border guards here. We do have our recommendations that when people travel from a high incidence area, that includes Florida, they quarantine for 14 days. It's something we don't really have the mechanism to enforce, and so we're simply asking people to do that. Just practically, there's no other way to have it be stronger.
Thank you.
Thanks, Martin. We're going to start our questions on other topics. So if you do have other questions, you can raise your hand at this point. We're going to go to Mike D'Onofrio with the Philly Tribune.
Sure. Thanks. Is the city keeping track, I guess this is for Dr. Farley, is the city keeping track of positive COVID cases at the Parkway encampment or the encampment on PHA property in North Philly?
I don't know that we have any way of tracking whether they were at that encampment. That's not information that's collected when someone goes to a test site.
Yep. But I will say we are aware of some individuals who have been at the encampment that have tested positive, but we don't know if they are still at that location.
And Dr. Farley, is that concerning that you don't have a hold of how many positive cases may be in either of those camps in terms of the virus spreading?
Well, as I said, we're concerned about the encampments in general. If there's a cluster of people together, I don't know. There's other settings where we don't have that information as well. So we prefer to have that information. It's I'm not sure how much worse it is than other settings.
All right. And then I guess the mayor's statement earlier said, right, the clearing of the encampment on the parkway isn't going to happen tomorrow, but it left out the PHA encampment. Can somebody comment about whether they're going to be removed tomorrow? If so, how, et cetera?
We plan on meeting next week. We are planning on meeting next week to try to take another personal run at the organizers. We have done a lot of work, and also have tried to do a lot of work with the folks in the encampment. Some have been successful in our interaction. We've been able to place people in various places that are safe. And we've had resistance from some elements of the organizers to keep our folks, outreach workers, away from the campers. And we're going to have that conversation again. And I really want to continue to try to take a personal approach so this ends in as amicable way as possible, and that people get the services that they need. And we're going to take another attempt.
So just to be sure, is the city going to forcibly remove individuals that don't comply with the vacate order at the PHA encampment tomorrow at 10 a.m.?
It's my understanding that that's not happening unless PHA has some additional information I'm not aware of.
No, it's Kelvin Jarmeyer from PHA. We are coordinating our efforts with the city, and so we are postponing any action while we have talks are ongoing.
All right. And I guess for the mayor too, organizers have said for the Parkway encampment that their one primary demand is permanent low-income affordable housing in the city, and specifically using vacant PHA properties. Is the administration able to provide that and willing to do that?
No. First of all, there's a waiting list of about 5,600 people who have been dutifully waiting for housing opportunities. A lot of the PHA, and Kelvin can illuminate, a lot of the PHA properties have to go through a process. So there will not be a house for every single person at that encampment. But what we hope to have is a plan to be able to address their needs now and get them into the system so that they could eventually be housed. But it's totally unfair to expect that we're going to jump 100 people. We're able to place people at a hotel. The COVID, the side people were grateful for the opportunity.
I'm sorry,
almost like a military.
Last like 15 seconds. Hello?
Mayor, could you just restate what you just said? You were breaking up a little bit.
Break it, Brainer, Kelvin.
Kelvin, if you want to elaborate, we're just having some connectivity with the mayor.
Yeah, I'd be happy to. There are about 47,000 people on PHA's waiting list. In our view, it will be fundamentally unfair to have folks who have not been in the pipeline, who have not been waiting for housing, jump that pipeline simply because they were able to get into a squatted site, for example. PHA's properties are held in trust to the federal government. I am not able to simply turn over units without going through the regulatory process that takes, in some cases, a year or two. We have to go through that process. I don't have the liberty to merely turn over properties. We're happy to explore that process and working with the city to do that. But simply turning over those units is not something that I am able to do as the protesters described.
All right, thank you.
Thanks, Mike. We're going to go to Dania Henninger with Billy Penn.
Hello, this is actually back to the COVID issue. Sorry, I didn't get my hand up quick enough. Dr. Farley, just a quick question on one other disparity that I noticed, or that some restaurant owners were talking about between Governor Wolf's recent order and Philly's rules. As far as I know, so Governor Wolf's order said that anyone at outdoor dining areas must order food along with drinks, like they can't just sit out there and get drinks. And I know that I thought that Philadelphia's requirements were just that the place had to serve food as well as drinks, but not like for each individual customer. I've heard from some bar owners who are frustrated about the differences there. Am I correct in Philly's describing Philly's policy, or?
You may be. I had not recognized that there was that difference between the state and Philadelphia. I think what the governor wanted to do is basically close bars, but allow restaurants to stay open. And so the way he defined it, because there's no legal difference between a bar and a restaurant in the state of Pennsylvania. That's the way he defined it. So whether it's appropriate for us to take action based upon alcohol consumption or food consumption, something for us to look into. I'm not also sure if we have the legal ability to do it. Now, I would say this, the governor's order applies in Philadelphia as well. We could be more restrictive, but not less restrictive. So his order ought to apply here as well. So we'll have to look into how that exactly does apply.
Okay, yeah, I mean, his release says, customers must order food if they're ordering drinks. So I guess that is the case now in Philly also.
This is just occurring to me right now, but it sounds like it. We'll look into it to be sure.
Okay, thank you.
Okay, great. Thank you. Back to Natasha Brown with CBS 3.
Hi, this is just for Brian, or I don't know if Mayor Kenny is back on the call, but just wondering, will there, I know you're going to be meeting next week with, some of the encampment leadership, trying to place people as quickly as you can, I'm sure. Is there going to be another timeline, or how long is this just going to play out until you feel like you can place people properly?
Look, we want to continue to try to negotiate and have interaction with the folks there. We understand their motives are sincere, and they want to see people housed as we do. It's a national problem. It's a statewide problem. It's a local problem. The issue is that what's there now is unsafe. It's unsanitary, and it's a possible hotspot. We don't know yet, but for the virus. In addition, there's been some violence there, some stabbings. So it's getting to the point where it's devolving into a real concern. And we really do want to address the issues that they're raising, at the same time keep people safe and healthy. And at some point, the encampment is not sustainable indefinitely.
Okay. Thank you very much.
Thanks, Natasha. We're going to go back to Shaira Arias of NBC 10 Telemundo.
So this is a question, just one last question related to COVID. Armando, ¿me escucha?
Shaira.
Ok. A pesar de todos los riesgos que implica la apertura de los gimnasios y un ejemplo, lo mismo que ha dicho el doctor Farley, que ha advertido por el sudor, las gotas de saliva y todo lo demás que implica cuando una persona está haciendo ejercicio, lo difícil que es mantener una mascarilla en estos lugares cerrados. ¿Por qué abrir los gimnasios pero no abrir indoor dining, comer adentro de los restaurantes donde no va a haber sudor ni nada de eso?
Okay, this question is for Dr. Farley once again. My question is, since you have announced that gyms will be reopening in spite of the sweating that takes place in there and the saliva drops that may be spread when people are not properly wearing a mask, why open gyms and not open restaurants when there's going to be no sweating involved in there?
Yeah, a couple of things. First of all, the virus is not spread through sweat. The virus is spread through respiratory secretions, what comes out of your mouth. And we are opening gyms with very strict enforcement that they wear masks 100% of the time. That wearing of masks cannot take place in a restaurant where people are eating and drinking. And that is the fundamental difference there. That's why restaurants are more high-risk environments than gyms or other places.
Hay dos cosas que tengo que puntualizar al respecto. La primera es que el virus no se propaga a través del sudor, se propaga a través de las secreciones respiratorias. Y los gimnasios van a reabrir con un número de normas que son 100% involucran el uso de las mascarillas, un protocolo de seguridad mayor, pero obviamente en los restaurantes hay un riesgo mayor que en los gimnasios porque obviamente la gente no puede utilizar las mascarillas mientras come y bebe.
Ok, la segunda pregunta es, avísale al alcalde que yo sé que ya él acaba más o menos de decir más o menos sobre esto, pero que lamentablemente se tiene que repetir para que lo puedas traducir en español. Básicamente, el plan era de que mañana se iban a remover, desalojar a estas personas, pero ¿qué cambió entre hoy, en el día de hoy, para que eso ya no se lleve a cabo? Y en dado caso, cuando se tenga que llevar a cabo, ¿cómo van a poder desalojar más de 100 personas? Son como casi 200 personas que me dicen los comunicadores que están allí ahora mismo.
Okay, this is a question that has already been touched upon by the mayor, but it needs to be put forth in Spanish for our audience. What are the plans for removing those people of the encampment? And what has changed to postpone their removal? Because there's nearly 200 people.
Well, we've had success in moving encampments in the past in Kensington and other places. Again, we understand the issues that they're raising. We believe that they are valid issues, but they're valid issues nationally. And we're going to try our best to deal with the requests, to deal with the issues that the people there are facing, to try to get them into a process where they ultimately are housed in a permanent situation. But as Kelvin Jeremiah explained, there's a long waiting list, but there are other things we can do in the interim to help them with their needs. But again, as I'll reiterate, it's becoming worse, an unhealthy, unsanitary, unsafe situation that cannot be sustained forever. And rather just going in today and removing people, we wanted to make an additional effort to have additional conversation and dialogue with people to try to get them to the point where they will leave on their own, or we can take them places where they can get the help that they need. What the future holds, I don't have the ability to tell you right now because we haven't had the conversations yet.
Lo que quiero responder, y esto es algo que se ha dicho ya, obviamente, es que hemos tenido éxito en el pasado al remover estos campamentos que se han dado, como ha sido en el área de Kensington. Nosotros comprendemos que los temas que ellos mencionan son temas válidos. Estos temas se dan a nivel nacional y vamos a tratar de enfrentarlos y resolverlos. Como ha indicado el señor Calvin Jeremiah, sería injusto también el desplazar a las personas que han estado ya en una lista de espera para encontrar alojamiento seguro, que es lo que estamos tratando de hacer, darles un alojamiento más permanente. Y obviamente entendemos que hay riesgos y que es un ambiente insalubre el estar en este campamento, pero la gente tiene que dialogar y tenemos que ver que la gente quiera irse por cuenta propia, si es que tiene lugar a donde ir, o que nosotros podamos darles ayuda adicional para encontrar un lugar donde ellos puedan alojarse permanentemente.
Thank you. Thank you. Gracias, Armando.
Bueno, adiós.
Thank you. We're going to go to Jack Tomsick now of Metro.
Yes, this question, I guess, would probably be for Dr. Farley. Some of the camp residents of the Parkway camp, they believe that they're safer there in an outdoor setting than at a homeless shelter. Is that true in your opinion?
You know, it depends on what they're doing in the camp, and it depends on what they're doing in the homeless shelter. There's no categorical answer there. And I would not think that is not an excuse for the camp to stay there.
Right, thanks. That was my only question.
Thanks, Jack. We're going to go back to Al Lebrano now of The Inquirer.
Thank you. Because there were negotiations, then the negotiations stalled, and now the decision to close the Parkway encampment has been reversed. Can we infer that the city reversed this decision because something new in the negotiation has changed? Are you closer?
First of all, it's not been reversed. It's been delayed. There's a big difference. Secondly, I think that I owe these folks, and I think I owe the people who live in the community or in Logan Circle, my personal attention, along with Kelvin's personal attention. And I believe that, I'm not sure if the council president has been confirmed or not, but maybe he'd be involved in having a face-to-face personal conversation with these folks who we respect and understand their concerns. I want to express to them personally that this is not a long-term sustainable situation. There are hygiene issues. There are issues of people's, personal needs. There are issues of violence. People have been stabbed there. There are issues of unknown issues of COVID, and it just cannot be sustained. But I believe that it's important for me to talk to them personally, and for Kelvin to talk to them personally, and possibly the council president, just to explain to them our situation, hear what they have to say, try to address in the short term and long term what their needs are. But I think that they deserve that personal attention, and I'm willing to do that, and I'm hopefully it'll be a good outcome. But it is not sustainable forever.
Mr. Mayor, how would you describe how you are going to personally intervene?
I'm going to personally talk to them, which I haven't done yet. All the interaction has been between our employees, between people in the city, and the people leading the protest. I think that myself, I don't know whether or not I'll be successful, but I'd rather make the effort than to not make the effort and see if we can't resolve it. But there are serious health, safety, and other issues there that cannot go on forever.
When will you be going to the encampment to speak with people?
We're not going to be talking about location. This is going to be a private meeting, and we will hopefully resolve some issues and make some progress.
Thank you.
Thanks, Al. We're going to go back to Mitch Blocker now of NBC 10. Mitch.
Thank you. Mayor O'Brien, can you please describe how the city has removed these kinds of encampments in the past, the techniques that are used?
Brian, you want to take that?
Sure. Mayor, did you want to start?
You want to talk about the notice we have to give, the posting, the personal interaction, that kind of stuff. Yep.
Absolutely. So on encampments, our encampment resolution has been extremely successful when we've used it in the past. It starts generally with a posting of the area to let individuals know that they will have to leave on a date specific and a time that those individuals will have to leave. From that point forward, outreach is invested heavily into the area, trying to find individual housing plans and solutions for the individuals who are staying in the camp. And then that work continues throughout the time period between posting and action. On the day of action itself, the majority of the work is done by social service providers, where people are connected to services if possible. In the few instances where we've had people refuse to leave, police have been used on a very kind of individual basis. This is not a police action primarily. This is really around how do we get people help, but also provide relief to the surrounding neighbors. And I think it's also important to note that anytime we've had an encampment, when we've taken materials, tents, personal belongings, we hold that material for a period of time to make sure that people have an opportunity to collect their belongings in the future. Make every effort to make sure that this isn't punitive, but at the same time, really connect those individuals to the services they need.
Would you authorize the use of force on protesters who don't leave?
Well, I mean, people will be asked to leave. They'll be given opportunity to leave. But at some point in time, if it's resisted, then yeah, we will have to move people and move the tents. I mean, there's no other way to do it, Mitch. If we're going to talk. We've been talking. We're going to continue to talk. We're going to continue to provide services. But at some point in time, the parkway needs to be cleaned. We have concern about human waste and all kinds of stuff there, and not only the parkway, but up in Strawberry Mansion, we have a concern about there also. And there's an area near the art museum that's also impacted, but not as much. So I mean, no, we're not looking to use force in any situation. But at some point in time, the government has a responsibility to make things safe and to make things hygienic, and people are at risk. Their health is at risk, and the health of the community is at risk if this continues to be allowed to continue. And we're going to do our best in a forward-thinking and positive way to deal with folks and to get them what they need.
Have police made any arrests at the encampment site due to the stabbings or any of the other violence?
I'm not aware of that, Brian, if you know.
No, I'm not aware. Mitch, we can circle back with the police department on the investigations on the stabbing specifically.
Okay, thank you. Thank you, gentlemen.
Thanks, Mitch. We're going to go to Susan Phillips now of WHYY.
Hi, thanks. This is for Mayor Kenny. Since the talks have stretched so long and they went to an impasse, I'm curious to know what you think your role is at this point, like how you think you can help make a breakthrough here. And I'm also wondering if you guys have ever considered using a mediator for this issue, because it does seem like the two sides are at least philosophically on the same page.
I'm the mayor. I have a responsibility to all the citizens of the city. And these folks that are in this encampment are also citizens of the city. And the people who live in the neighborhoods in Strawberry Mansion and in Logan Circle are citizens of the city. And I have a responsibility to try to mediate and to broker some way through this impasse. I don't have a magic wand, and I can't tell you exactly what's going to happen, but I will feel better about this entire situation if I at least make an effort along with Kelvin to try to get to a point where they want to be and we would like them to be. I mean, there's nothing else. I can't speculate beyond that other than what we're trying in good faith to do.
Susan, I just want to, so for the last several weeks, we have been working through mediators, third-party mediators to communicate with the encampment. To your point, I think we are philosophically aligned and hopefully to the mayor's point, we can reach resolution.
I mean, what do you think is the big sticking point right now? Like, what do you think is the big obstacle to coming to a good resolution? That's, you know,
one of the obstacles is the resistance amongst the sponsors or the leaders of the protest or the encampment, is to allowing our folks our outreach folks to interact with some of the unsheltered people that are there. I mean, we can't identify their needs, help them with what they need if we can interact with them. And that's been a kind of a bone of contention with the organizers not allowing or kind of trying to stop our outreach people, non-police outreach people, from interacting with folks to see what their needs are. And that's a big issue because we can address some of the problems if we can interact and talk to people that are encamped there. And that's one of the things we'll be talking about next week.
And I think I would only add, Susan, is that I think many of the organizers expect the city to resolve these issues on our own. And frankly, the housing crisis, and not just in Philadelphia, but across our country, is not one that cities and urban areas can solve by themselves. We need our federal government to change its housing policies to make it easier to provide long-term sustainable housing to our most needy individuals. We are doing everything we can to provide housing for our residents, but we can't do it alone. And federal policy has really blocked federal policy and funding, for that matter, has really been a hindrance.
Thank you.
Thanks, Susan. We're going to go now to Pat Loeb of KYW.
Hello?
Oh, sorry. Am I unmuted now?
Yes.
Okay. You've mentioned hygiene a couple of times, but the organizers say they have a contract with a porta potty company to address that, and that the city actually pressured the porta potty company to end the contract with the encampment. Is that true?
No.
I'm not sure of the current, Brian, if you know.
So the organizers, a third party did rent porta potties for the encampment. I have no knowledge of the city making any pressure to cancel that contract at all. And in fact, I think we made an effort to maintain that contract. So I think that is going to be an ongoing situation, but we certainly did not pressure the porta potty company to pull out.
Thank you.
Thanks, Pat. We're going to go to the WPVI desk. You just need to unmute yourself there. Okay, we're just trying to get the mute situation.
To unmute you. All right, can you hear me now?
Yes.
Okay, this is regarding the trash pickup situation. There has been an inundation of phone calls here saying people can't get through to 311, saying that they're now 6 to 7 days with trash not being picked up. Is there a broader problem with the trash? Some have speculated a contract with the landfills may have been exceeded by how much trash was being brought in from Philadelphia. Is there any truth to that? Or
Brian can illuminate this, but I can tell you, if you think about it logically, our people have been staying home now for 5 months. And I know in my own living situation, we've been producing a lot more trash and garbage than we would have if we were going to work every day, or people were going to work every day and eating out more as opposed to eating home. So you're going to have a natural increase in trash and garbage because of the situation we've been living through for the past 5 months. In addition, there's been some concerns and issues relative to our workforce, their concerns over their safety. There's been some calling out sick and not showing up, and we're working with our union brothers and sisters to get that resolved. My understanding is I don't know if we're 6 or 7 days behind. I check on that status every day, and the last time I checked, we were back up almost to schedule, and I think the last time we were a day behind. And I recognize it's a problem for people, but we're in a pandemic. We're producing a lot more trash. Our workforce has a capacity that is not inexhaustible, and we're doing our best every day. But we're in a situation that is historic. It has never happened before to have all of this going on at the same time. So our workers are working extremely hard. They do their best job they can, but some days they just can't make it in because they're exhausted. and we're doing our best to keep up with it. And I believe we're relatively up to date with it, unless Brian has something else I don't know. But that's where we are.
Yeah, no, and I don't have much to add from the mayor. I don't believe we are 6 or 7 days behind. We have certainly begun to adjust our operations, including balancing overtime within budget constraints, deploying more trucks and available staff when possible to accommodate the increased tonnage. And we're shifting crews from collecting one material, trash, or recycling to the other to make sure that we catch up. This is a complicated issue. We're experiencing workforce shortages due to injuries, COVID-19, other illnesses, and requirements for quarantining crews exposed to COVID-19. Plus, the department seeing large increases in trash and recycling.
It's been a little hot too, but it's been a little hot too. By the way, if anybody's not noticed that, it's been hot, and this is a historic pandemic and practical financial depression. I mean, I think our workers are doing a pretty goddamn good job, frankly.
Yep, they are, and not to mention 2 major storms last week. So all of that has contributed to the challenges, but we are certainly making adjustments to catch up.
Okay, and this last question is for Dr. Farley. The question going around our newsroom is the governor comes out yesterday, says we're reducing in restaurants to 25% because we're so concerned about an escalation. And now the city of Philadelphia says, but we're opening up gyms. And that's indoors, not necessarily the best ventilation. Just wondering how the city got around to that decision-making process on the heels of what the governor said yesterday.
Yeah, I can understand the question, but the real issue is what's the risk in the situation? And that risk is tied very strongly to whether people are wearing masks. And in gyms, we initially didn't open them because we were concerned that people would not wear masks, but we've come up with a mechanism to enforce that. And we hope we get very high levels of compliance. If we don't, then we'll be shutting gyms down. In restaurants, people cannot be wearing masks. I'm still far more worried about the restaurants that are open in the rest of the state at 25% capacity where nobody's wearing masks than I am about gyms where people are wearing masks.
Thank you.
Okay, thank you. We have time for one more question. We're going to go to Mike D'Onofrio of the Tribune.
This is a quick one. Mayor, I just wanted to double check on this. Did you say you'll be meeting with organizers for both encampments, the one on the Parkway and the PHA property one, or are you letting the PHA? Yeah.
My understanding is it's a delegation of people, which I believe are from both of the encampments, and that's my understanding, unless I've been informed differently. And by the way, I want to apologize for using goddamn good job. I should have used just damn good job. So anybody that's offended by the use of the word God, I apologize.
Mike, the meeting will entail both camps, representative from both.
Okay, that's all I got. Thanks.
Okay, thank you all. That concludes our briefing today. We will be back next Tuesday at 1 p.m. Thank you.
Thanks.
Thank you.
Yeah.